is bone cancer? Bone cancer refers to the development of malignant tumors within the bones. These tumors can originate within the bone itself, primary bone cancer, or spread to the bone from other parts of the body, secondary or metastatic bone cancer. Primary bone cancer is relatively rare, with several subtypes, including osteosarcoma, chondrosarcoma, and Ewing sarcoma, among others. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Standard of care treatments for bone cancer. The standard of care treatments for bone cancer depends on the type, stage, and location of the cancer. Common treatment options include surgery. Surgery is often the primary treatment for localized bone cancer. Surgeons aim to remove the tumor and surrounding healthy tissue to ensure complete excision. In some cases, limb-sparing surgeries are performed to preserve function and appearance. Chemotherapy. Chemotherapy involves the use of drugs to kill cancer cells or slow their growth. It is frequently used in combination with surgery to treat aggressive forms of bone cancer like osteosarcoma and Ewing sarcoma. Radiation therapy. High-energy rays are used to target and destroy cancer cells. Radiation therapy may be used before or after surgery or as a primary treatment in cases where surgery is not feasible. Targeted therapies. Some bone cancers may be driven by specific genetic mutations. Targeted therapies, such as denosumab, are designed to inhibit the growth of cancer cells by targeting these specific genetic alterations. Immunotherapy. Immunotherapy is an emerging treatment approach for certain types of bone cancer. It works by stimulating the patient's immune system to recognize and attack cancer cells. One website to check for promising bone cancer treatments is onclive.com. Seriousness compared to other cancers. Bone cancer, while relatively rare compared to some other cancers, can be serious and potentially life-threatening. Its seriousness depends on factors such as the type, stage, and location of the cancer. Some bone cancers, such as osteosarcoma and Ewing sarcoma, tend to be aggressive and can have a significant impact on the patient's prognosis. Prognosis for Stage 1 bone cancer. The prognosis for Stage 1 bone cancer is generally more favorable than for later stages. In many cases, when bone cancer is diagnosed at an early stage and has not spread beyond the bone, the prognosis can be quite good. With appropriate treatment, including surgery and possibly adjuvant therapy like chemotherapy or radiation, the 5-year survival rate for Stage 1 bone cancer can be relatively high, often exceeding 90%. Prognosis for Stage 4 bone cancer. Stage 4 bone cancer indicates that the cancer has spread, metastasized, to distant organs or bones. The prognosis for Stage 4 bone cancer is typically less favorable as treatment becomes more challenging. The 5-year survival rate for Stage 4 bone cancer varies depending on several factors, but it is generally lower than for earlier stages and can range from less than 10% to 30% or slightly higher. Promising therapeutics for bone cancer. Ongoing research is exploring promising therapeutics for bone cancer. Some areas of interest include targeted therapies. Researchers are investigating targeted therapies that focus on specific genetic mutations and pathways involved in bone cancer growth. These therapies aim to improve treatment effectiveness and reduce side effects. Immunotherapy. Immunotherapy approaches, such as immune checkpoint inhibitors, are being studied for their potential to boost the immune system's ability to recognize and attack bone cancer cells. Precision medicine. Advancements in precision medicine are allowing for more personalized treatment approaches based on the unique genetic characteristics of a patient's tumor. This can lead to more effective treatments with fewer side effects. Why is bone cancer tricky? Bone cancer presents several challenges, making it a tricky type of cancer to manage. Late diagnosis. Bone cancer may not cause noticeable symptoms in its early stages, leading to delayed diagnosis. As a result, it is often diagnosed at more advanced stages when treatment is more challenging. Variety of subtypes. There are various subtypes of primary bone cancer, each with distinct characteristics and treatment approaches. Tailoring treatment to the specific subtype is essential for optimal outcomes. Complex surgery. Surgical treatment for bone cancer can be complex, particularly when tumors are located near critical structures. Balancing the removal of cancerous tissue with preserving function and appearance can be challenging. Aggressiveness. Some bone cancers, like osteosarcoma and Ewing sarcoma, are highly aggressive and can metastasize rapidly, requiring aggressive treatments. Pain. If the cancer is in a bone that is commonly used and weight-bearing, like the legs, it can cause significant pain. List of medications used against bone cancer. Medications used in the treatment of bone cancer can include chemotherapy drugs, targeted therapies, and other supportive medications. Some medications used against bone cancer include chemotherapy drugs, doxorubicin, cisplatin, efosfamide, etoposide, methotrexate. Targeted therapies: denosumab for giant cell tumor of bone, imatinib for gastrointestinal stromal tumors that may affect bones, pazopanib for some sarcomas. Supportive medications: pain relievers, for example opioids, antiemetics to manage nausea and vomiting, bisphosphonates for bone metastases. The book Cancer Self-Defense 101 Quick Tips to Help You Survive describes several integrative treatment options, including pain management options that do not rely on opiates, which can be immune suppressive. Treatment plans for bone cancer are highly individualized and depend on the specific type and stage of the cancer, as well as the patient's overall health. Patients diagnosed with bone cancer should work closely with a multidisciplinary healthcare team, including oncologists and surgeons, to determine the most appropriate treatment strategy for their condition. Early diagnosis and access to advanced therapies are crucial in improving outcomes for individuals with bone cancer. For more information, please see Cancer Self-Defense 101, Quick Tips to Help You Survive.